This is Dee Dee, and Dee Dee is a 7 to 8 year old Chihuahua mix, and she looks very sleepy because we have already given her a little sedative, which includes a tranquilizer and something preoperatively to address pain. And she has what we call a stage 4 periodontal disease. And periodontal just refers to disease and infection of all the ligaments and soft tissue and gum that keep the teeth in the mouth. And you can see how loose they are. And you can pull back that lip and see all that tartar. And we've got tartar everywhere. So we're going to do a dental prophy, which means we're going to clean these teeth and extract anything that needs to be extracted. If we leave in teeth that are loose, we're also leaving in a source of pain. So one of the first things we're going to do is put an IV catheter and get her ready for some fluids, because you want fluids while they're under surgery to help with that blood pressure.
And how often do you do these types of surgeries?
We try to do at least 1 to 2 a day. Where's your clippers? Your clippers. We try to do at least 1 to 2 a day, depending upon our other surgery load, our caseload. And it also depends too on how many dogs and cats come in with this degree of dental disease.
So Dr. Patti, how long have you worked here?
I started October of 2009. And
so just about 10 years.
Yeah, 10 years.
Why have you decided to stay with HSPPR so long?
I stay with HSPPR because I believe in their mission. I believe that the shelter animals, through no fault of their own, have come here, and most of them have never seen a veterinarian before. Most of them have medical issues and surgical issues that their owners probably couldn't afford to address, and there are many situations where they have to surrender their pets to a shelter. So by coming here, we're able to medically and surgically give them every single thing that they need, get them extreme makeovers in some cases, and get them to a point where they feel better. When they feel better, they look happier, and maybe we can get them into a new home. So I also believe in how we support the community. We do vaccination clinics, spay and neuter, infectious disease control. When there's a rabies positive skunk, we are the first out there to promote vaccinations, which is very important wellness. So I believe in the mission. I believe the animals deserve the very best. I believe the community also deserves the very best. So that's why I stay.
Well, I love that. Thank you.
You're welcome.
Perfect. Are you excited to be back in Pueblo again?
I am very excited to be back in Pueblo. I'm born and raised in Pueblo, and I have been in private practice here in the city of Pueblo for many years. And so making the transition into shelter medicine has been not only an eye-opener 10 years ago, but it's also become what I call the good hard work, because this is a very emotional position to be in, shelter medicine. We see a lot of difficult things. We see a lot of sad things. We turn those sad things into very positive things. We see a lot of interesting cases, and it gives me a chance to not only work with the dogs, it also allows me to spend some time in the community getting to know people in this area. So I thoroughly enjoy shelter medicine, and because Pueblo is my home, I like to be here to help support my community, because my community really has, in private practice and with shelter medicine, have supported me very much so. And so it's a way of me giving back to the community it's also a way for me to give of myself to the animals who really need for us to be there for them.
What do you think is the most important thing the Pueblo people should know about our organization?
Our organization is going to always put people and community first. They really look at the community and their pets as having a really special bond, and it's that human-animal bond that is first and foremost. We do extensive amount of training in all departments, so to make sure that we are all educated, trained, have the tools, the instruments that we need to do our job is also very important to them. And so we also work on culture. We like a culture where we have good teamwork, good communication. We spend an awful lot of time in a very small little building sometimes, and so it's important for us to have good teamwork, good communication skills, and to be able to just help each other out in any department. Because as I said earlier, this is not an easy field. So for example, Ramona and I work very well together, and I know Ramona, I know when she's struggling with something that's difficult, I can help her out, and she knows me quite well, so she knows when I'm getting a little stressed with the case. So we have that balance, and that's something that this organization, again, really puts an effort into teamwork, team communication, team skills.
And what does your typical day look like, and can you tell us your exact title?
My day starts off with surgery, and sometimes the surgery case is either 5 to 6, depending upon the shelter population. It can be up to 20 to 25 spays and neuters per day. There may also be dentals, very much like this one here. We can also have trauma cases come in through animal control. And so many times our best laid plan can sometimes have a little bit of a glitch when an emergency comes in. So we are really good about changing channels when we need to and just go with the flow.